So safety and environmental impact assessment, industrial perspective, yeah. So sort of subtitled Safety Science in the 21st Century. So really a company like the one I come from has certainly in the last few years seen enormous changes in the way we do things and try to do things differently in the way we're assessing chemicals that are going in our ingredients. So over these sort of 5 weeks, we'll try and give you a bit of a flavour for that. So say something about the industrial perspective. I'll say something about the company itself that I come from. Not that I want to sort of sell Unilever to you particularly, it's just that so you can see what the drivers are, why we want to do things differently. So quite a lot about risk assessment and the importance of risk assessment principles. And then really the core of what we're talking about on this module, this course, is this idea of pathways-based risk assessment, safety assessments, and this sort of modernisation of toxicology that's going on at the moment. The key things, this TT21C, this toxicity testing for the 21st century. It's not my acronym, I'll explain where that comes from. So we're going to sort of overview the elements of this sort of safety assessment, and hopefully by the end, some of my colleagues will probably be better when you can see some sort of case studies, how you can actually bring this together and make some decisions on chemicals. So that'll be right at the end. So I've chucked in a few acronyms, a bit of a glossary there, so just so you don't get lost straight away. So TT21C, toxicity testing for the 21st century. AOP gets bandied about a lot now in toxicology, so that's adverse outcome pathways. I'll explain where that comes from. You can probably ignore source to outcome pathway there. Some of my chemistry colleagues will talk a lot about MIEs, molecular initiating events. So everything starts from this kind of molecular initiating events and trying to make decisions about what the potential a chemical has, and potential molecular initiating events that it might give rise to is very important. And then really understanding what happens in cells and the sort of dose response of what happens in cells, which we can term biodynamics, BD, as important. And we have to relate that to what happens with respect to the actual exposure that we have to chemical ingredients in products. So that's the biokinetics, the BK. And trying to make the leap between something you measure in some in vitro system and what actually might happen in the human body, or in an environmental or an aquatic species. We have to make some leaps, so we have to do these quantitative in vitro to in vivo extrapolations. So that's the QIV-IVE. Okay, and I think my slides are probably peppered with RA and SA, which is just safety assessment, risk assessment. Okay. So, structure of this thing, probably know better than I do already, but we're going to have me just droning on, introducing it all to you. All right, so 2 lectures this morning and the workshop this afternoon, where you can do a little bit of work, and then a little bit more about these molecular initiating events and making decisions on those from 2 of my colleagues. Then, the impact of what happens and how you might measure it in cells, the biodynamics, and then how do we relate that to the exposure that we see in people, biokinetics, and some case study examples at the end. And we'll also, this year we've added in some more in the environmental tox world there, because the same principles are being applied as well in the environmental tox work that we do at Unilever. So one of my colleagues there, Ollie Price, will give a talk as well. So let's just kick off then. So this is just about Unilever. All right, so you can just see why we want to change things and why we need to change things. So does everybody know Unilever? Everybody not know Unilever? Maybe that's an easier one. I mean, a lot of people know Unilever but have no idea what the hell Unilever make or manufacture. But it's a very, very big company, so it's one of the world's leading suppliers of fast-moving consumer goods, so CG is a sort of stock market term. So we make a lot of different things. Just a quick bit of background. So it's actually formed from two companies. It's an Anglo-Dutch company. So from a Dutch margarine company which came together with the Lever brothers who made soap up in Liverpool. And they essentially had the same need for raw material, which was oils, and formed a company out of that, so Unilever. A few quick facts. So sizable. So turnover about 50 billion euros, that is. Sales in about 190 countries, and increasingly so-called emerging markets, of which China is especially important, now represent a very large part of that turnover, about 57%. And we spend about €1 billion a year on R&D worldwide. And that company is sort of split into four divisions or categories around the products. So we have a sizable part of foods. We have a home care division, so cleaning products for your home, bleaches and the like. A very large personal care business. So all the things we've all been using this morning in the shower and getting ourselves ready, deodorants and shampoos and skin creams and the like. And also a big refreshment category. So that's teas and ice creams. Wall's ice cream, also Ben & Jerry's ice cream. It's not American, it's Anglo-Dutch. Yeah, I would win you over easily, couldn't I? Just become laden down with all sorts of goodies. But I'm afraid not. No. Maybe I can have a word with some of my colleagues. Maybe they can get them to bring something in. Okay. So there's, in total, actually, it's a very large company. It has over 400 brands worldwide. So, you know, if you're in China or Nigeria, you might see certain things from Unilever rather different than you'd see here. But then there are certain brands which you pretty much see everywhere. And some of these are very large. They're like very large companies in their own right, so they're billion-euro brands. So in the personal care area, some very big ones like Dove and Rexona and Lux and Axe and the like. And some of these familiar ones, I'm sure. But I'm not trying to advertise for Unilever. The idea is just to get across the message that, you know, companies like this, whether it's Unilever or Procter & Gamble or L'Oreal or some of the chemical companies like Dow and DuPont that supply the sort of ingredients, you know, there's lots and lots of products being made, and there's lots of innovation behind it. So Unilever file about 300 new patents a year, so there's lots of new things coming online all the time. So lots of new ingredients, lots of products. You know, these brands have lots of different products underneath them all. So there's a huge impact for the health of consumers and, of course, the health, if you like, of the environment where those ingredients end up. So we do have to have a robust safety assessment of those ingredients for the consumer products. And so the way Unilever do that is to sort of centralise those assessments of that safety into one organisation. We call it SEAC, the Safety and Environmental Assurance Centre. So this is the building based at Colworth in Bedfordshire, where I work, and all of my colleagues that are going to speak to you subsequently all come from. We're all mainly based there. There's about 200 people in SEAC, and there's a fewer, but also important number of toxicologists and some microbiologists who work in Bangalore as well. So and all of us are employed really for assessing these ingredients, and we tend to think in terms of what we would say COE&S. So we're always considering the potential for consumer safety, and and certain headings under that, toxicology, immunology, microbiology, physical hazards of things. If you come up with a fancy new top or a lid on something, is that going to be a choking hazard for a child or whatever? We're also, in the O, we're thinking of the occupational safety. Are the people that are going to manufacture these ingredients and products in the factories, are they going to be safe? Or are we coming up with something that could be dangerous? And ultimately, we're also thinking about what's going to happen to the fate of those ingredients and products in the environment. Are they going to have a significant effect, an impact on the environment? And that's tied in very much also with our sustainability agenda, which is very large, but we won't be touching on in this module. Okay? Now, the most important principles that we work to in SIAC are to really characterize the hazard, the exposure, and the risk. This is very much a risk-based organization. So I'm sure you probably already had some lectures and thoughts around this already. I mean, risk assessment principles and this sort of equation that risk really is a function of hazard times exposure. A few nodding of heads. Yes. Okay. So just in simple terms and silly terms, Mr. Lion here is particularly hazardous, but there's no risk to us as long as he's behind the bars. Equally, often you might have people from categories or new ingredients coming or suggested for products, which in the face of it might be from natural products or natural things that the simple assumption is maybe something natural is safe, but something as simple as an apple. If we were to take those pips and concentrate them up and take the cyanide-containing compounds from them and make something concentrated and put that into a product, then we could harm people. So it's all about the dose, really. And of course, one of the most extreme examples of that, you can take one of the most potent toxins known to man, and in the right setting, botulinum toxin, use it in a safe way. So it's an organisation which is very much about assessing the risk, and that has distinct advantages for us. If you're working simply to identify hazards, just the hazards for new ingredients and products, then it tends to be very about checklists, going down lists of tests that you might have to do. And that means you end up doing a lot of unnecessary testing. From a true industry perspective, that means spending a lot of money, maybe unnecessarily, and you end up making very conservative decisions. Whereas if you anchor your decisions into a risk-based way of working, you only end up doing the testing which is essential, and you can be quite explicit about the risks and the options to actually manage those risks. So I think I would say probably all of us in SIAC are bored with this slide, which gets used an awful lot. But this is when we have this sort of question from a category, those divisions that I mentioned. When they come up with something new, a new ingredient, we're always asking the question: can we use X% of that ingredient Y in the product, within the setting and the use of that product, whether that's a food stuff, a personal care product, or whatever it might be. Make sense? So that sort of process, that risk-based approach to evaluating consumer safety and consumer products, means you have to, right at the start, ask a number of specific questions. You start with, what is the product type going to be? Is it new, a deodorant? But is that deodorant a roll-on deodorant? So therefore, are you going to have direct skin contact, or is it maybe in an aerosol? Maybe there's an inhalation risk. How will the consumer use it? What will the levels of that ingredient be? The amount in the product? How frequent might a consumers use it, and how might they actually abuse the use of that product? What would the root of the exposure be, and is there a retention factor? Is it something that goes like a skin cream, goes on your skin and stays there? Or is it like a shampoo, you put it on and we wash it off straight away? So there's a retention factor to consider there. So you can bring all these things together and make exposure assessment decisions. One of my colleagues will talk in more depth about that, and how we really try to spend a lot of time making very accurate decisions and measurements around what the actual exposure would be to either humans or environmental species. And we team that then with our hazard identification and characterization. So if there's a new ingredient we're going to use in this product, is there existing toxicology data? Sometimes there is. This is maybe produced by a chemical company which they have quite a lot of information around. Maybe it's something that already has a safe history of use, a botanical that's going to go into a shampoo, but it's an extract of a peach or an apple or whatever it might be. So is there information that we can use there? Is there human data? Can we use QSARs to make decisions? I won't say anything about that because my colleagues will. But can we bring in all this together and make that decision around the risk characterization? Now, unfortunately, of course, sometimes you don't have any information. You just have a new, maybe quite novel chemical, novel ingredient that's going to go into this product. So therefore, you're going to have to do something. You're going to have to do some tox testing. And in the past, we've always thought of this as sort of targeted testing. Again, we won't necessarily do this sort of checklist of all the possible tox tests that we could do. The world of pharma actually does have to do quite a lot of that. Pfizer will know this. There are sort of ICH guidelines which really set out that everything has to be done, and that has to be produced, and a dossier produced for a regulator to assess. In this world, it's much more fluid, much more focused on what you think the risks would be. And that's something which is certainly changing, evolving, and improving, I think. It has been in the last few years, very, very dramatically in the last, say, 5 years. And some of what we've been doing in Unilever and with some of our partnerships and research collaborations, we've put on a website, which is tt21c.org. So actually, if you want to see any of this talk or many of the other talks from my colleagues, you can pick those up from that website. It's actually undergoing a bit of a revamp at the moment, so I think in June it'll be quite different, but it will be better. So, just everybody happy so far? Yep, a few noddings, okay. Nobody's asleep just yet? No? So, just, as I say, things are changing, so for the 21st century, but just looking back a little bit, so for toxicity testing in the 20th century, this is really where all the sort of tests that we have traditionally used have been generated. Certainly, maybe in the last 70, 80 years, some of the original tests came about. Some of the typical tests that we would use animals for, assessing systemic tox, reproductive tox, carcinogenicity, developmental tox. They came together, maybe as early as the 1950s, and some of the risk assessment principles, the US Food and Drug Administration using factors of 100 and uncertainty factors to make risk assessment decisions, was quite some considerable time ago. And these have been built upon by other agencies like the US EPA, the Environmental Protection Agency, continuing this expansion of tests that build up this number of assays and tests which could be used to make decisions on different pathologies and different endpoints. And things haven't really changed an awful lot. I'm not going to say an awful lot about this slide because perhaps you can use it as a starting point for the workshop that we're going to be doing this afternoon, all right? When I'll say some more about that then. The thing about doing batteries of tests and assays is that it's very easy for toxicologists to kind of forget why we're doing them. You know, you're just doing them because the regulator set out these sets of tests. But really, the reasons we're doing this, of course, we're trying to get necessary information about the products and the chemicals in those products to just safeguard humans and the environment. We're using what, really, we just need appropriate test systems to evaluate the responses of those chemicals in those test systems, and then to interpret the results and extrapolate those results to humans or species in the environment. It's not the tests themselves aren't important, it's how you make those decisions, how you use those data to ensure safety. The other important thing that's very important for a company like Unilever and you know, competitors like Procter & Gamble and L'Oreal, and those in the, certainly in the consumer products world, is to keep a very strong sight of the 3 R's principles. Everybody come across this book, kind of old now, The Principles of Human Experimental Technique, Russell and Birch, which really set out this original concept of the 3 R's. You know, if you're using animals, you must be thinking about replacement, reduction and refinement. And that's actually at the heart of toxicology, or tox testing. And certainly in the personal care world and the consumer products world, there have been a number of successes in recent decades in using non-animal alternatives to things. And there really are no excuses now to be squirting products into the eyes of rabbits to look at eye irritation, or trying to assess the corrosivity or irritation on skin. There are perfectly acceptable, validated tests available to assess these things which now have OECD, test guideline, validation, and the law states that you should be using these. Well, they're great, but they're limited. There are agencies which, like ECVAM and ICVAM, which help in the validation of these new assays, but it's a slow process, dreadfully slow process. And it's something toxicology has really needed a bit of a boost, a bit of an impetus to start to change. And certainly in our industry, I was to say something about the drivers for our industry, you can't sell things if people don't want them. And the consumer is king or queen, really. And certainly with this personal care product division and the large part to our company, people increasingly, certainly in the West, do not want their consumer products, personal care products, tested on animals. You see this in many companies. It's actually a selling point, whether it's Body Shop or Lush or whatever, leaping bunny symbols on things. People want some confidence that you're not using animals in the assessment of the safety of these products. They want safe products, absolutely safe products for themselves and their families, but they don't want them tested on animals. So this, recourse to doing tests and targeted testing becomes much more difficult, much bigger challenge. And of course that's where our traditional risk assessment strategy starts to fall down. When you've got complete uncertainty around a new chemical agent, a new ingredient, the traditional way of doing things, sure, this is an overview, but I'm sure you've had some lectures about different tox tests and how they're done. But whether that's a 90-day study for systemic tox in rodents, or a developmental tox, or reproductive tox, or carcinogenicity testing, essentially you're coming down to a matter of treating largely rodents at high doses, maximum tolerated doses, and seeing what happens. Just seeing what happens in those animals. And that's a matter of, if you can see something at the high doses, you then titrate back until you get a point where you've got a dose where nothing happens in those animals. You can then set a point there, a null or no adverse effect level. Okay, nothing happens in the animals at this dose. And then traditionally we use that null, and then we have to make some judgments, some risk assessment judgments. And we use what we term uncertainty factors. Nothing's better named than that. Because this is kind of saying, well, okay, we did this in rats, but we're really concerned about humans. Let's take the null and divide by 10. Oh, but humans aren't all the same, you know. We've got different polymorphisms and different things about ourselves. And so let's divide by another 10. And actually children are different than adults, so let's maybe divide by another 10. And actually the dosing regime in the rodents was different from the exposure that we'll have for the humans. So maybe we divide by another 10. So you just increase these factors to make a decision around the safe dose in humans. So it's a bit flawed, to say the least. So you're often making a decision on an apical endpoint, what we call an apical endpoint, so this high-dose endpoint, which might have actually no relevance. It might have relevance to the human physiology and the human situation, but sometimes it has no relevance. And that also tends to ignore the enormous, but very well known, enormous differences between animal bioavailability to drugs and chemicals and human bioavailability. This is from quite a famous paper, but largely ignored paper, where you can see it's not the most defined correlation there. So, consumers don't want you testing animals. The animal tests are not always particularly great. They have served us well, and they are still, there and part of the regulatory process. But could we do things differently? And a big sort of shot in the arm and a boost to the world of toxicology came in 2007. This report. Anybody seen this report before? Or led towards it? Yeah, a few. Okay, so this was written. This came out of the National Research Council, National Academy of Sciences in the United States, who every now and then sort of get smart people together in a room and try and tackle thorny issues and difficult areas of science. And they decided to take on and look at the state of play and the state of art in toxicity testing. And they came up with this book. It's available on the web. Give you the web address so you can look it up if you'd like, which is called Toxicity Testing in the 21st Century, A Vision and a Strategy. And it wasn't really written with the, set out to say, well, how do we do testing without animals? It wasn't about that. It was saying, how do we make the most of the science that's really available to toxicologists and has been happening since some of these tests were developed in the 1950s. Have we been sort of ignoring some of the explosion in science and the possibilities there that we could actually apply to toxicology? And there's lots of good things in there, but I pick out a couple of them. But this is, it did say that was, advances in things like toxicogenomics, bioinformatics, systems biology, and especially computational toxicology could actually transform tox testing from a system based on whole animal testing, I've just described, to one founded primarily on in vitro methods. So in vitro methods, test tube methods, that evaluate changes in biological process using cells of human origin. Just to give a sort of the roster, the list of the smart people that actually produced this report, 22 people, many of whom have gone on to sort of rather promote this way of thinking, this TT21C vision, and have started this quite a lot of different areas of research and a lot of companies as well being involved in trying to make this vision a reality. This is another figure from the report, but they really were trying to set out sort of the options for future toxicity testing strategies, and that we could just stay with the status quo where We're working entirely in vivo. We're anchored in animal biology. We're looking really at high dose effects, apical endpoints. It's low throughput. It's really expensive, very time consuming. Doesn't say there, but often it's quite misleading. We use large numbers of animals, and different sort of possibilities all the way through to entirely in vitro. Trying to anchor things primarily in human biology. Because it's much more high throughput, you can look at lots of different doses. It would be attractive to industry, certainly, in being less expensive. Actually, often it's not the money that it costs as much as the time that it costs for companies. It would be less time consuming. Virtually, it said no animals, but it could be no animals. And it would be about understanding perturbations of toxicity pathways. So really trying to understand the mechanisms by which chemical agents give rise to toxicity and understanding why that happens and at which doses that doesn't happen. So again, to steal something from the report, but it outlined a not so distant future where all routine tox testing will be conducted in human cells or cell lines in vitro by evaluating these perturbations of cellular responses in a suite of, and this terminology was used, toxicity pathway assays. Another figure, again, just to drive home this idea of toxicity pathways, that in time we would reduce what we do in this place of targeted testing and rodent testing, to replace it with tox pathway assays, but we'd frame it in the understanding the risk and the exposure, the relevant exposure data in this space. Now, since that report came out, a number of other organizations have become very interested in this, but one of the valuable agencies that have recognized the importance of the report was the OECD, so the Organization for Economic Cooperation and Development. So this is the kind of body that puts together these harmonized assays and tests, and tries to iron out the differences between different areas, different regions, so that we're sort of all working from the same hymn sheet, really. And the OECD in this space came up with this terminology of adverse outcome pathways. That really, if we should be in toxicology trying to define these AOPs. And they said the AOPs were really a sequence of events from understanding the chemical structure of a target chemical or an ingredient to these molecular initiating events, the primary things that might happen in a cell that give rise to toxicity, and for how that might give rise to toxicity through a cascade of events, the mechanistic processes, and giving rise to an adverse outcome. Really, it was, for them, they're sort of recognizing that if people were going to come up with information and tests and data which was going to be very different than traditional testing, then there has to be a way of capturing that and producing the sort of narrative of events so that regulators would know what they're looking at, and so that regulators themselves could make decisions on different data in toxicology. There's some nice figures out there which try to illustrate this. This is one from Kevin Crofton at the EPA in an OECD document. So really trying to say that we need to better define how we're exposed to things, but better in this new way of thinking, better define these molecular initiating events and what happens at the level of the organelle, the cellular tissue events, organ events, effects, and how that gives rise to potentially toxicity or adverse outcomes in individuals or populations. And one of the advantages for us is that this, by focusing in on mechanism, it doesn't really matter really whether you're considering human health or aquatic species or environmental species. And the same is true, the same principles are true. But the important part of it is this idea of we need to properly characterize and understand toxicity pathways for a new ingredient. So, again, taking from that report, it's very simple, really. The key process that you ought to understand is to understand the process of toxicity pathways, perturbation of toxicity pathways. So, very simply, and actually this is taken from, this is the reference really of the tox testing of the 21st century report, Krusky et al. In any cell in our body we've got thousands of different biological inputs and biochemistry going on at any given time, and that gives us our normal biological function. But if we're exposed to a chemical agent at very low doses, we may have perturbations at the lowest levels which give rise to actually no changes in that normal function. Okay? But if we increase the dose of that chemical agent, in true Paracelsus sense, the dose makes the poison, at higher doses we start to see these perturbations becoming significant. But cells have ways to deal with that. There are early cellular changes, or more importantly, there are adaptive stress responses to different chemical agents. Very specific responses to chemicals. And those adaptive stress responses are a departure from the normal function, but they get us back to the normal biological function. Yeah? So this is kind of the key thing in that report, and this is what I was trying to highlight, that really as toxicologists we've ignored this process. And if we could better understand these adaptive stress responses and use those as part of our risk assessment process, then we could change things. It's only at the highest doses that we would see the proper departure and toxicity and cell injury. And that's what we tend to focus in on and then try and work back from in our animal studies. And as toxicologists, we don't have to sort of invent all of this. We just have to sort of open our eyes to some of the science that's out there and available to us. Many of these adaptive stress responses, very well characterized. And actually, many of them, whether it's oxidative stress, responsive to oxidative stress, or DNA damage, metal stresses, osmotic stress, inflammation, etc. There are very common structures to these stress pathways. There are typical kinase sensors see this sort of damage and then respond, transducers, and commonly kinase-mediated pathways which bring about an effect and try and get us back to normality. So, companies like Unilever and others, we have to start to think about what are the pathways that would be important for our given ingredients. What might be affected, and we can do that by looking at past chemicals and past things which have had toxicity. A great many chemicals and maybe have toxic mechanisms through pro-oxidant effects, or can be free radical based. Are we really considering how those sort of chemical agents are dealt with in a normal cellular system? Mitochondrial toxicity is important. How do things actually affect different receptors, whether agonists or antagonists? And we could start to build up a picture of how these things might actually be affected. So I've got a bit of a silly analogy really for that. So this is sort of kind of an overview of tox testing for the 21st century. I think what we've done for years and years now in traditional tox testing with our rodents and our animals and our apical endpoints is to treat those animals at high doses and just look for a kind of disaster. See induce a disaster like a flood, and that's quite fun as toxicologists because you do this kind of pathology on animals and you're seeing something interesting has happened. But it's a very high dose effect, and you can't. In the analogy here, you've no idea where the river is anymore, really. In the TT21C way of thinking, we have to really up our game in understanding these stress response pathways, the rivers, and how they meander across the land, and where they start, when they finish. And then for our ingredients, the question becomes not, can we induce a flood, but are we, in the use of the product and the ingredient within the product, are we just kind of adding a thimbleful of water to this stress pathway, this network, and there's no effect? Or are we actually, producing an absolute deluge, a monsoon of an effect? So the river's going to burst its banks, and we're going to have some toxicity and effects. And that's what we have to try and characterize. Now, I don't think, those of you from the pharmaceutical world, probably this isn't necessarily going to be appropriate, and certainly not going to be great for the regulatory environment for the pharmaceutical world. Because in the pharma world, you're setting out to have a profound pharmacological effect on people. You're deliberately setting out to have things very bioavailable and to have perhaps a very specific or sometimes non-specific receptor effect and pharmacology there. But the personal care consumer products industry, and we can probably use this way of thinking for our needs, because we're generally using things or producing things which have topical exposure. It's not always the case, but often they can be very low skin penetration, low bioavailability. And they can generally, but not always, they're intended not to have any pharmacological activity as such. So can we make this sort of exposure-led safety decision based on the confidence that the safe level is within or below an adaptive homeostatic response, and capture that by appropriate in vitro systems and complement that with network computational models, which you'll see some of later on.